I'm Leigh Williams, and I'm excited to be a part of today's episode of Health Talks from the Inside Out.
Leigh Williams, Executive Director of the Williamson Health Foundation. Thank you for coming and sitting down with me today to be a guest on our podcast.
Oh, you're so welcome. Anytime I get an opportunity to talk about Williamson Health and the great things that we do, and then cross it over with my little hidden love for being on talk television is really exciting.
There we go. Okay, I didn't know two loves coming together. Well, that's great. Well, let's get into it. Can you begin by telling us a little bit about yourself, maybe some of your background and your role at the Williamson Health Foundation?
Okay. Well, I've been in Williamson County all my life. I was born at the original Williamson County Hospital when it was Williamson County Hospital. Right. And so I grew up around here, went to high school around here. And when I had the opportunity to come to Williamson Health in 2013, it was so exciting for me to kind of come back home and do something in nonprofits and raising money and just doing great things, having a big impact. And 2 years ago, I became the executive director. So it's really exciting to be able to use all the experience that I've gained in all those positions and all the relationships that I've built with the community to do great things for the community's health.
Yeah. So for people who might not know, can you explain to us what the foundation is and how it fits in with Williamson Health?
Williamson Health Foundation is the philanthropic arm of Williamson Health. And so everything that we do, we are working to secure philanthropic gifts to support the programs and services of Williamson Health.
Which is so important because some people might not realize Williamson Health is a freestanding, independent nonprofit. And aside from the partnership we have with Williamson County for EMS services, the county gives us a portion of funds to help with that. But aside from that, we don't get any additional revenue other than what we bring in ourselves and then the support that the foundation helps to raise.
That's right. And even though we receive some support from the county for EMS, we don't receive all the support that's required. So we work to raise funds for the different service lines. So EMS would be one of those services that we like to tell the community about and the great service that we offer so that we can pour back into that service. And then again, it benefits the community.
Right. So what are some of the real ways that this philanthropic and community support actually comes to fruition here for our patients, for our service lines, for our employees?
I'm so glad that you asked that because I love to talk about what we're able to do for Williamson Health and its whole service lines, employees, everything. So whether it's tangible equipment that we're able to purchase that because maybe it's outside the budgeted dollars for Williamson Health, or maybe it's the way that we're able to help our fellow employees who might fall on difficult times and need some type of assistance. And sometimes it's just supporting a service line like the breast health service line, which is a great asset to our community, as all the service lines are at Williamson Health. But of course, most people identify with that in particular. So we've done things over the years. We've purchased the 3D mammography machine, and Williamson Health was one of the only systems in this area to have that kind of technology. And it was made possible by a philanthropic friend of ours. Wow. And they loved so much that they could hear stories of how having that piece of equipment actually was saving lives.
Wow. So that's an example of a big, expensive piece of equipment that the foundation was able to come alongside and help us with. What about some of the smaller gifts too? I know that this summer, when we were celebrating 10 years of our pediatric services, the foundation was able to come be part of that celebration and purchase some gifts. So can you talk about that?
Absolutely. So this summer, when we were celebrating the 10th birthday of the Monroe Carroll Jr. Children's Hospital Vanderbilt at Williamson Medical Center, philanthropic gifts made it possible for us to purchase a couple of new iPads and gaming systems for some of our younger patients who need things to do to keep their minds off of what's going on when they're in the hospital. You know, there are distractions that need to happen sometimes because, I mean, I don't know about you, but anytime anybody comes towards me with a needle, it's scary, or stitches are scary. And you think about those kids that come into the emergency department and they need support. They need somebody to normalize the environment for them. So purchasing those iPads and the gaming systems allows our child life specialists to work with those patients and to make their visit a little less intimidating.
Yeah. So for people who might not know, our system, Williamson Health, we work very closely with Williamson County Schools to offer a free comprehensive sports medicine program. So Williamson Health, working in conjunction with Bone and Joint Institute of Tennessee and the foundation, we are able to offer, as one part of that program, athletic trainers at each of the public Williamson County high schools that do sports. So can you talk a little bit about how the foundation fits in with that?
Absolutely. So to me, this is one of the most exciting things that we are able to assist with and partially fund. The athletic training program, I feel like, touches so many lives, not just those of the athletes. So there are about 7,500 athletes in Williamson County who benefit from that athletic training service. But it touches their parents too. We do host a golf tournament every year that has really turned out to be a fantastic event for us and helps to support that athletic training program.
Okay, Operation Pink Chairs. Can you talk about that for a minute?
Absolutely. Operation Pink Chairs was an opportunity that came to us by way of a student at Brentwood High School. She had a personal experience with her mother who had been diagnosed with breast cancer, and someone loaned a recliner to her mother to recover. Out of Olivia's personal experience with her mother's journey with breast cancer and surgery, needing a recliner chair being provided by a friend of hers, Olivia thought, wouldn't it be great if I could provide so many patients a chair? And so she worked with another community contact, Head Springs Depot, and together, Williamson Health Foundation, Head Springs Depot, and Olivia Bratcher, we were all able to provide an invaluable service to our patients of the Turner DeGott Breast Health Center.
Yeah. Well, and I love the idea of that because that's something, unless you've gone through that or seen somebody go through a cancer journey or even recovering from some sort of surgery, you might not know that something as simple as a recliner can make all the difference in the recovery. So it's just so neat to hear about a very practical and real way to come alongside some of these families and help offer support.
It is a really sweet and a really unique project and a really unique service that we're able to provide to the community. A volunteer from our auxiliary sends a care package to the patient. And so they get a blanket, they get some other items to help them while they're on their journey of recovery.
Yeah.
So it's a very sweet service and just kind of a little nod from Williamson Health that somebody's thinking about them, other than the breast health navigators who are there with them.
They're amazing. Yes. Yeah. So you mentioned some of our volunteers. So let's go ahead and talk about that because I really think that's a behind the scenes program here around Williamson Health that the foundation manages that people might not know about. So can you talk to us about our volunteer auxiliary?
Oh, I would love to because they're some of my favorite people. And anybody that walks in the hospital sees all of them wearing their pink. And I tell them that there are many times the first faces that are seen and the last face. And so they're able to support those patients in ways that the patient probably doesn't even realize is going on. But our volunteers are a very special group of people. They come in sometimes 4 days a week even, and spend lots of hours pushing wheelchairs, transporting patients, discharging patients, delivering flowers, or delivering gifts from our gift shop. Our gift shop is run 100% of the time by our volunteers. And any purchase that is made in our gift shop pours back into Williamson Health through the foundation. So they've been able to do some really cool things in the last few months. They purchased new furniture for our cardiac rehab.
Wow.
They've purchased transcutaneous bilirubin monitors. And if you don't know what that is, I'll try to explain. I'm not very clinical, but I did bring my babies here and they had their heel pricked for like a week straight, but with a
to check their
bilirubin levels. And with a transcutaneous bilirubin monitor, it's just a simple holding it up. It's digital.
Right.
You hold it up to their skin and it tells you what their bilirubin level is, and there are no pricks and no crying because of that.
Yeah.
Maybe other reasons like being hungry or something, but not because of a prick.
Wow. And we have all different types of volunteers, right? Different age ranges, different stages of life. So anybody who's interested in volunteering, they could just reach out to the foundation, look on the website.
They can visit the website and find the volunteer application. And we have volunteers that range mostly from college age up to later in life.
Okay. And often they have experience that they bring too, their background from their previous jobs or other volunteer opportunities they've had. They can speak into
that is true.
How to make things better sometimes.
Yes, and we even have volunteers that work in the emergency department. They do things from folding blankets or getting patients more blankets if they notice that they might be cold or something, or take them out of the warmer. But they do provide an extra touch.
I love that. Okay, you mentioned the gift shop and that the volunteers fully run that. I know we're very proud of our gift shop. Can you talk a little bit about what people might see and find if they come shop in our gift shop?
Yes, there are so many fun things in the gift shop. We have items that are gift items, and we have clothing. We have Williamson Health apparel that is a very popular item in the gift shop. But we also have baby gifts, and we have flowers. We have so many options, and many times people might think that they have to have someone in the hospital to come and visit in order to shop. But we want to be that boutique right by I-65 where somebody needs to stop and get a gift at the last minute. They know they could stop right in Williamson Health and visit the gift shop and find something that would fit their needs.
That's great. And it's right in the main lobby. When you walk in the main lobby of the main hospital tower, right by the flagpole.
Yes.
If people want to come do some shopping.
Yes.
Okay.
Yes.
Okay. So one of the biggest projects, at least in recent years, is the capital campaign, our More For You Close to Home campaign. So can you walk us through that, what it is, what it's done, how it's evolving?
The More For You Close to Home capital campaign is a $30 million capital campaign to support the expansion of Williamson Health. That included the emergency department. It included our labor and delivery unit, our neonatal intensive care unit, and we have a new heart center, a new cardiac center, which is so exciting that we were able to put in an electrophysiology lab. So now that we can take care of patients who have pacemaker procedures that are needed and they don't have to go anywhere else, they can do that here. And then we constructed a 6th-floor tower. The total for the expansion renovation project of Williamson Health was over $180 million. And of course, Williamson Health Foundation wasn't responsible for securing philanthropic gifts for the total amount, but for a portion of that we did. And we've been able to see the completion of the Boyer-Bryan West Tower and the completion of so many things. The new neonatal intensive care unit is incredible. Right. And the fact that Williamson Health has a service like that most community hospitals do not have is incredible for our community, because people don't want to go anywhere else. They want to have their baby. And if there are challenges along the way and they need to be in a NICU, then they want to stay here as close as they can to their family. So because of funding, because of community partners, philanthropic gifts, we've been able to assist Williamson Health in providing that new beautiful space for our patients.
Yeah. And it is beautiful. And you just gave me a new podcast episode idea. We could probably do a whole episode on the new tower because you're right. It is absolutely beautiful. For those of you who might not have seen it, we opened it back in 2024. And it's absolutely beautiful. So yeah, maybe we'll do a future episode where we'll go floor by floor and talk about that.
Oh yeah, that's so fun.
Yeah,
I love that.
And so the first part of the capital campaign was the expansion, which we just talked about, expanding and opening the new tower. But now the second phase is to go back in and renovate the existing tower of the hospital. So the campaign is still technically open, right? You're still raising funds for that.
Yes.
And then hopefully we'll be able to go back in and renovate the old patient rooms to match the new patient rooms.
Yes. And you know, it's so fun with the gifts that we receive is that we're able to recognize those gifts. You might walk into a patient room and outside you see a little sign that says, this room has been provided by a generous gift by Dr. Brian Perkins' son and his family. And so there's so many examples of that in the West Tower and actually all over the hospital because we have some really, really great friends who have done some wonderful things to help us with the project so far. But like you said, we're not done yet. And so there's more work to be done. And with philanthropic support, we'll be able to help Williamson Health grow even more.
Yeah. So another really special program that we have run through the foundation is the Physician Leadership Council. So can you talk a little bit about what that is and why it's so special and meaningful to who we are?
Yes, I can. Several years ago, we had a group of physicians. I think it was 10 physicians who were faithful supporters of Williamson Health through the foundation. And we thought, you know, what a great way to grow this and a great way to show the community what philanthropic support can do, as well as what their physicians are doing and think is important, was to create a physicians leadership council where physicians can give of their time, their talents, and their resources to be a part of this giving circle per se. So it's been really exciting. We have over 30 members of the Physicians Leadership Council. We pin every new member. So some of them laugh and say it's kind of like a fraternity, but honestly, it's just a symbol that they love Williamson Health and they love to be able to serve the community, and they want everybody to know what it means to have a system like Williamson Health.
Yeah. I love that. And on the flip side, we also have something similar on the employee side of the system where we have an employee annual giving fund where several different employees from around the system give of their not only time and talents, but of their resources.
That is true. And it's so important. Community members and other people who want to be future supporters of Williamson Health look to our leaders, and whether that's a nurse or that's somebody who works in the cafeteria, those are leaders and those are influencers in the lives of our patients. So if they see that an employee is participating in our STAT campaign, which is our annual giving campaign, Success Takes a Team, it influences them and makes them want to support Williamson Health as well. And so what a wonderful way to see how Williamson Health employees are so proud of where they serve if they want to give back. And it doesn't matter about the amount.
Right.
It's the number of people that would like to participate.
And just the act of giving. Yeah, that's great. Okay, so we've talked about many different ways that the foundation supports the Williamson Health system. What are the different ways that community members can get involved with the foundation?
In addition to volunteering and making a monetary donation, there are other ways that anyone could be involved with Williamson Health and Williamson Health Foundation. We've taken on so many events in the last 6 months, and we continue to grow and do fun things. Our golf tournament, I mentioned that earlier. We had a C3 event this year with Ben Zobrist, and you might wonder, what in the world does C3 mean? With us, it's Connect, Compete, and Care. Right. So Williamson Health Foundation partnered with Bone and Joint Institute. That program,
and then Champion Forward is
and
Ben
Champion
Zobrist's
Forward, yes,
organization.
with Ben Zobrist. We offered an event for parents and for student athletes to come in, and we talked a little bit about the ins and outs of athletic training
Yeah.
and school sports in general.
Right.
We've started a women's health panel, our Jennings Circle, which is a giving circle created for the foundation. We offer every quarter, we offer health topics that are of interest to women, and they're able to come and learn about that in about an hour and have lunch with us. So it's so fun. We start the men's health panel series. We also did something new this year that we're calling it our inaugural event because we're already planning next year's. And it was really, really exciting. It was a night to celebrate excellence in philanthropy.
Yeah.
And we called it the Williamson Health Honors Event. We decided that it was important for the community in general to know what Williamson Health does and what philanthropic gifts have done to help Williamson Health along the way through the foundation. So this year we chose to focus on our breast health service line, but each year we will choose a different service line to focus on to give out 5 awards. Those awards are in leadership, legacy, mission impact, community, and the heart of healthcare. And so we're excited about what next year's program is going to bring and our new friends that we make along the way. We were able to raise, it's a great it's fun to get together.
Right.
And it's fun to create awareness. But what was most exciting about Williamson Health Honors was that we raised over $1 million for the More For You Close to Home capital campaign.
Yeah. So we were able to, as you said, come together. We celebrated and we recognized 5 different amazing award honorees, and then we raised a bunch of money too. So it was great.
It's so fantastic.
Yeah. So what would you say is the most rewarding part of your job?
The most rewarding part of my job is that while I am not a nurse, I am not clinical at all.
Right.
I am able to build relationships with grateful patients, with community members in general, all in the name of Williamson Health. And as a native Williamson County girl, it means a lot that I'm able to give back to the community in that way to help support the mission of Williamson Health in providing for the healthcare needs of the communities we serve.
Yeah. I love that. And what you and your colleagues, your board, everybody at the foundation does is so vitally important to what we do. So that is so appreciated.
Thank you.
Okay, well, thank you for being with us today. This hopefully has been very enlightening to folks in the community so they understand who the foundation is, how they can get involved to support everything we do here at Williamson Health. So thank you.
Thank you for hosting me. This was so fun.
This is good. It's been fun.